Remember in the movie Contagion when Gwyneth Paltrow's character unknowingly spreads a deadly virus around the world? Well, life is imitating art once again as health officials warn that the monkeypox outbreak has taken a serious turn for the worse. Just when we thought we were done with global health emergencies, monkeypox decided to make an unwelcome comeback tour. But this isn't your grandma's monkeypox. We're dealing with a new, more infectious variant that's causing havoc in Central Africa. Over 21,000 cases and 600 deaths have been reported so far, mostly in the Democratic Republic of the Congo. The World Health Organization has officially declared it a public health emergency of international concern. That's bureaucrat speak for time to panic. But don't cancel your plans just yet. Cases outside Africa are still limited. However, health experts warn this could change rapidly if the new variant starts spreading globally. From vaccination campaigns to travel screenings, officials are scrambling to contain the outbreak before it spirals out of control. The situation is particularly concerning given the challenges facing affected regions. Limited healthcare resources, ongoing conflicts, and widespread poverty have created a perfect storm for disease spread. Meanwhile, the international community is racing to mobilize resources and coordinate a response. But with vaccine supplies limited and distribution networks strained, containing this outbreak will be no easy task. As we dive into the details of this unfolding crisis, we'll explore the science behind the new variant, the factors driving its spread, and the global implications if containment efforts fail. We'll also look at what individuals can do to protect themselves and their communities. So slap on some PPE, folks, because this monkeypox crisis just got way worse. And understanding the full picture has never been more crucial. A prelude to crisis. Before the emergence of the new Clade A variant, the world had already grappled with a significant monkeypox outbreak in 2022. This earlier epidemic, primarily caused by the Clade II variant of the virus, caught the global health community off guard and exposed vulnerabilities in our preparedness for emerging infectious diseases. The 2022 to 2023 outbreak began in May 2022, with cases initially reported in several European countries and North America. Unlike previous monkeypox outbreaks, which had been largely confined to Central and West Africa, this epidemic quickly spread to multiple continents. By July 2022, the World Health Organization had declared the outbreak a public health emergency of international concern, PCIC, signaling the seriousness of the situation. What made this outbreak particularly notable was its pattern of transmission. While monkeypox had traditionally spread through close contact with infected animals or contaminated materials, the 2022 to 2023 epidemic saw sustained human-to-human transmission, particularly among men who have sex with men. This shift in epidemiology presented new challenges for public health officials and required targeted interventions to reach affected communities. The global response to the outbreak was swift, but not without hurdles. Vaccines originally developed for smallpox were repurposed to combat monkeypox, but supply shortages and inequitable distribution hampered early containment efforts. Many countries struggled to implement effective testing and contact tracing strategies, particularly in the face of ongoing COVID-19 pressures on healthcare systems. Despite these challenges, the international community eventually gained the upper hand. By May 2023, after infecting over 87,000 individuals across more than 100 countries and causing 140 deaths, the WHO ended its global emergency declaration for the monkeypox outbreak. The relatively low fatality rate, less than 0.2%, and the eventual success of vaccination and public health information campaigns were cited as key factors in bringing the epidemic under control. In the aftermath of the 2022 to 2023 outbreak, health authorities around the world sought to learn from the experience and strengthen preparedness for future monkeypox threats. Surveillance systems were enhanced, vaccine stockpiles were increased, and research into monkeypox transmission and treatment was accelerated. However, as cases of Clade II monkeypox continued to be detected at low levels worldwide throughout 2023 and early 2024, experts warned against complacency. Little did they know that even as the world breathed a collective sigh of relief at having contained one monkeypox threat, a new and potentially more dangerous variant was already emerging in the remote corners of Central Africa. The lessons learned from the 2022 to 2023 outbreak would soon be put to the test in ways that few could have anticipated. the emergence of a new threat. In April 2024, researchers in the Democratic Republic of the Congo, DRC, made a troubling discovery that would soon shake the global health community. In Kamituga, a remote mining town nestled in the lush forests of South Kivu province, they identified a novel subgroup of the clade 1 monkeypox virus. This new variant, dubbed clade Ib, appears to have undergone significant genetic mutations, allowing it to spread more easily between humans. The discovery sent shockwaves through the scientific community as it represented a potentially game-changing development in the evolution of the monkeypox virus. According to Dr. Placide Mbala Kingabini of the DRC's National Institute of Biomedical Research, the clade Ib variant exhibits a particularly concerning characteristic. It produces lesions predominantly on the genitals, making it more difficult to diagnose compared to previous strains that caused more visible lesions on the chest, hands, and feet. This subtle shift in symptom presentation raises serious concerns about the potential for silent transmission of the virus, as infected individuals may not realize they're carrying the disease until it's too late. The implications of this new variant extend far beyond its initial discovery site. Historically, clade 1 monkeypox has caused more severe symptoms compared to the clade 2 variant, responsible for the 2022 to 2023 global outbreak. Early data from clinical observations and laboratory studies suggest the new clade Ib variant is not only more transmissible, but also potentially more virulent than previous forms of the virus. This lethal combination of increased spread and severity has set off alarm bells among public health officials worldwide, who fear the makings of a perfect storm for a global health crisis. As researchers scrambled to understand the full implications of the new variant, cases began to multiply at an alarming rate. By September 2023, just 5 months after its initial discovery, infections of the new clade Ib variant were growing rapidly throughout the DRC. The virus seemed to exploit every weakness in the country's fragile healthcare system, spreading through communities with ruthless efficiency. In January 2024, the DRC government was forced to officially declare a nationwide outbreak, but by then, the situation had already spiraled far beyond their control. The emergence of clade Ib represents a significant evolutionary leap for the monkeypox virus. Scientists believe that the remote and isolated nature of Kamituga may have provided the perfect breeding ground for these mutations to occur. The limited contact between the town's population and the outside world could have allowed the virus to evolve unchecked, adapting to human transmission in ways that previous strains had not. This theory underscores the importance of global surveillance and early detection systems, even in the most remote corners of the world. As news of the new variant spread, it triggered a race against time among virologists and epidemiologists. Teams from around the world descended on the DRC, working alongside local experts to collect samples, sequence the virus's genome, and understand its mechanisms of transmission. Their findings painted a grim picture. Clade Ib appeared to have a significantly higher basic reproduction number, R0, than previous monkeypox strains, meaning each infected person was likely to spread the virus to a larger number of individuals. The scientific community's concerns were quickly validated as the outbreak expanded at an exponential rate. By August 2024, the situation had reached crisis levels, with over 18,000 suspected cases and 570 deaths reported in the DRC alone. The virus had penetrated all 26 provinces of the vast country, from the bustling streets of Kinshasa to the most remote villages in the eastern regions. The rapid spread highlighted the interconnectedness of modern society, even in areas with limited infrastructure. Rapid spread and global concerns. The outbreak's impact was particularly devastating in the eastern DRC, a region already grappling with ongoing conflicts, widespread poverty, and limited access to healthcare services. In the Goma area, a shocking 70% of new cases were reported in people living in displacement camps between June and August 2024. These overcrowded, unsanitary conditions provided the perfect environment for the virus to spread unchecked. Healthcare workers on the ground expressed grave concern about the lack of testing kits available in affected regions, making it nearly impossible to accurately track and contain the spread of the virus. As the situation in the DRC spiraled out of control, neighboring countries began to report their first cases of clade Ib monkeypox. Burundi, Kenya, Rwanda, and Uganda all identified infections linked to the DRC outbreak, setting off alarm bells across the African continent. By August 2024, a total of 15 countries had reported cases related to the current epidemic, marking a rapid and concerning geographic expansion of the virus. The international health community watched with growing alarm as the outbreak continued to gain momentum. On August 12, 2024, the Africa Centers for Disease Control and Prevention, Africa CDC, took the significant step of declaring the growing monkeypox outbreaks a public health emergency. This declaration was intended to mobilize resources and coordinate efforts across the continent to combat the spread of the virus. Just 2 days later, on August 14th, the World Health Organization escalated the situation further by declaring the epidemic a public health emergency of international concern, PHEIC. This designation, the highest level of alert that the WHO can issue, signaled to the world that the monkeypox outbreak posed a serious threat to global health security. The declaration triggered a cascade of responses from governments and health organizations around the world as the international community scrambled to mount an effective response to the crisis. The rapid spread of clade Ib monkeypox exposed glaring weaknesses in global health infrastructure and highlighted the ongoing challenges of disease surveillance and containment in resource-limited settings. As cases continued to multiply, it became clear that the world was facing a potential pandemic threat unlike anything seen since the early days of the COVID-19 crisis. The coming weeks and months would prove critical in determining whether the outbreak could be contained or if it would escalate into a full-blown global health catastrophe. Now it's time to hear from you. How concerned are you about this new monkeypox outbreak? Do you think enough is being done to prevent it from becoming a global pandemic? Share your thoughts in the comments below.